Assalamu alaikum. Hello everybody. I'm Dr. Khalid Al-Amin, and in this we'll talk about the chest wall or thoracic skeleton. In this session, we will try to, or by the end of this session, you will be able to identify the components of the thoracic wall like the ribs, vertebra, sternum, and costal cartilage. And you'll be able to differentiate between typical and atypical ribs and thoracic vertebra. And we will explain common clinical notes related to the chest wall. Let us start big. When we say the thorax, we mean two things, the thoracic wall and the thoracic cavity. So in this session, we'll talk about the thoracic wall and later we'll talk about the thoracic cavity. Let us start with the thoracic skeleton. The thoracic skeleton consists of 12 pairs of ribs and their costal cartilages, 12 pairs of ribs, thoracic vertebrae and their intervertebral disc, and the sternum. So these are the components of the thoracic wall. Let us see them in this picture. You can see here we have ribs, and as we said, we have 12 ribs. These are the ribs, and at the anterior end of each rib there is a costal cartilage as shown here. This is the sternum, at which the upper ribs and costal cartilage attach, and we will see a view from the back, from the posterior aspect, to see the thoracic vertebrae. And as we said, between each vertebra and the other we have an intervertebral disc. Ribs. There are 12 pairs, right and left, and we usually divide ribs into typical and atypical. So we have typical ribs and atypical ribs. Typical ribs consist of a head, a neck, a tubercle, a shaft, a costal groove, and anterior and posterior angles. So any rib which do not contain these constituents or components, it is an atypical. For a rib to be typical, it should consist of all this. So if a rib is missing a neck or missing a tubercle or missing a costal groove, as we will show in some ribs, they are atypical. What are this is rib 1 and this is an atypical vertebra because it only consists of a head and tubercle, and this is a shaft, but there is no subcostal groove, and it is missing some other features. This is the second rib, also it is atypical. And at the end here we have the 12, the 11th ribs. So these ribs, rib 1, 2, 11th, and the 12th, they are typical. And sometimes the 10th rib is considered also atypical, but other anatomists consider it typical. Here we have an example of a typical rib. And as you see, this is a head. After the head, we have smaller neck. Then we have a tubercle. And each of the head and the tubercle have two facets for attachment with the vertebra and the transverse process. This is a shaft. This is an angle. You can see here the rib is not straight, so here we have a posterior angle, and anteriorly it is not straight also, and it has a posterior angle. And at the other end we can see a subcostal groove also, which is an important. So this is the edge is an example of a typical rib. While rib 1, 2. Head of the rib contain two facets in typical ribs for articulation with its own vertebra and the vertebra above. So if we are talking about vertebra number 5, it has two facets in the head for the vertebra number 5 and vertebra number 4. The tubercle also contains two facets for transverse process and costo-transverse ligament. Okay, so as we mentioned in the first rib, it has a head, but the head has one facet for its own vertebra. So this is why, or this is one of the reasons rib 1 is not typical. This is the head. You can see in the head we have two facets. This is the facet for the vertebra above, and this is for its own vertebra. Here, this is a tubercle. You can see here we have this is a facet for transverse process, and this is a facet for costo-transverse ligament. This is the shaft with the angles, and here clearly we have the costal groove or the subcostal groove for the neurovascular bundle. So this is a typical rib. Any feature which is missing makes the rib atypical. These are the facets in the thoracic vertebra to which are attached the head, and here where the transverse process is attached. The atypical ribs include, as we mentioned, first rib, 11th rib, and 12th rib. Rib 2 and rib 10, as we mentioned, some anatomists consider them typical, others consider them atypical. So there are no cut ideas about these two ribs. Why atypical? Because they are missing some of the typical features. This is rib 1. It is atypical 1. This is rib 2. This is about the ribs. Let us talk about the sternum. The sternum has three parts: manubrium, body, and xiphoid process. Three parts. This is the manubrium, the body, and xiphoid process. And they are joined by joint shear. This is the sternal angle, and this is the xiphosternal angle. These are the connections between. Usually this part, after we will progress in age, it will fuse and just be one part. But this one, it will continue to be secondary cartilaginous joint. It has many names. We can call it the sternal angle, the manubriosternal angle, or angle of Lewis. Angle of Lewis. As we said, we can call it the manubriosternal angle or angle of Lewis or sternal angle. All these are names for this part, and this part is important anatomically. A lot of anatomical events occur behind this angle of Lewis. Also lower down we have the xiphosternal joint. Both are secondary cartilaginous, but as we mentioned, this one it will be ossified and be bony. What are the importances of the sternal angle? It has many important events which occur behind it. We can use it to count rib. Behind it we have the arch of the aorta, the azygous vein joining, the branching of the trachea, division of the thoracic cavity into superior mediastinum, inferior mediastinum, and so on. So we have a lot of things which occur at this sternal angle. It is a landmark. You can easily identify it as your anterior chest. So if you just start from the jugular notch here and you feel down, you feel a prominence here. This prominence is angle of Lewis. So if you go laterally, this is second rib, and you can continue counting ribs down. This is the sternal angle. For ribs, we have another division, and this division is according to their attachment to the sternum, because we said the upper ribs attached to the sternum by costal cartilage. So here we have true ribs, false rib, and floating rib. And be careful, this is something different from the previous division, which we talked about typical and atypical. There we talk about constituents which are present or absent. Here we talk about attachment to the sternum. So what are true ribs and false rib and the floating ribs? The ribs which attach directly by their own costal cartilage to the sternum, they are called true ribs, like the first rib, second rib, third rib, fourth rib, fifth rib, sixth rib, and seventh rib. But we have other ribs. If you look at the rib 8, 9, and 10, they are attached to the sternum, but not directly. They join together and they attach to the costal cartilage of the 7, which join them to the sternum. So they are false rib. 8, 9, 10. Sorry. If you go down to rib 11 and 12, they have no attachment to the sternum, so they are called floating. They are called floating ribs. So this is how we divide these ribs into true 1 to 7, directly attached by their costal cartilage to the sternum. If you are not attaching directly, you are attaching indirectly through the 7s. 8, 9, 10, these are false, while ribs 11 and 12, they do not attach and are called floating. You can see all these are 1 to 7, they are true ribs. In clinical practice, sometimes we need to cut the sternum in the middle. Example for surgery for the heart, and this is called sternotomy. This is called sternotomy. Okay, so what is sternotomy? Sternotomy when you open the skin, the subcutaneous tissue, then you open the sternum like this, and you are going for the heart surgery. This procedure is called sternotomy. Okay, so it is commonly used in cardiac surgery. The third part of the thoracic wall are the thoracic vertebrae, and there are 12 vertebrae, and between each vertebra and the other we have an intervertebral disc. In general, each vertebra consists of a body and lamina, pedicle, and a spinous process, and a transverse process. Okay, so we have a body and a neural arch, which consists of a lamina, pedicle, spinous process, and transverse process. This is the body, this is the spinous process, this is the lamina and the pedicle here, and this is the transverse process. Usually the thoracic vertebrae, because they attach to rib, they have costal facet here. So this is something which is very characteristic for thoracic vertebrae. They have costal facet. Other vertebrae, cervical, lumbar, and so on, they do not have this one. So this is very characteristic. So in practice, this will help you identify the difference between thoracic and other vertebrae. This is the body anteriorly. This is the neural canal. This is the lamina, the pedicle, transverse process, and this is spinous process. This is the costal facet in the body, and this is the costal facet in the transverse process, which attach to the tubercle of the rib. The characteristic feature of thoracic vertebra is costal facet. As we mentioned, costal facets are demifacets. Half demifacets means half facet, because each rib attached to half of a vertebra. And with the ribs, they form costovertebral joints, which are synovial joints, and these joints, they help ribs move during respiration. Okay, so this is a vertebra which is atypical because it consists of only one uh, costal facet here. So this is atypical. Typical vertebra consists of two facets. This is how the ribs and the vertebra join here in two joints, and this called costo-vertebral joint, and this is costo-transverse joint. These are the costo-vertebral joint, and this is costo-transverse joint. You need to read about the joints of the rib cage. We have a lot of type of joints as we've seen in the sternum, between the costal cartilage and the sternum, between the vertebra and the head of the rib, between the costal, between the tubercle and the transverse process. This is something which has clinical importance, which is called cervical ribs. Ribs should be in the thoracic part, but sometimes we can see uh, rib above rib 1. This is called cervical vertebra, and this cervical vertebra can be short like this, or it can be complete. And as you see here, usually or sometimes these cervical vertebra they compress the subclavian artery here, or they can press nerve. Okay, so they can cause clinical presentation. This is an X-ray with patient, and if this cervical vertebra causing problems compressing the subclavian artery or the first thoracic nerve, it should be removed surgically through surgery. This is an X-ray with cervical vertebra. So this is another clinical problem which can be facing us. Okay, so in this first part, we talked about the chest wall, we talked about the ribs, the sternum, and the vertebra. Together they form the chest wall or thoracic skeleton. Thank you very much. I hope you enjoyed this part.